I wanted to start by setting a contextual stage for our discussion and lay out how did we get here? How did this mess get created? And oftentimes we look at this as starting with the public health emergency as a result of COVID and the pandemic that started back in March of 2020. However, I, me personally, I've been involved in Medicaid managed care now since the mid 1980s. And I remember we used to scratch our head every month as we tried to do reconciliation around enrollment. Every month we would add all of our new members to the plan. We would we would subtract all of those that voluntarily disenrolled, and assumedly we'd come out with our new membership. But there was always a missing factor, and that missing factor were those members who would leave the plan due to involuntary disenrollment, typically tied to recertification issues. So the recertification issue has not been, it's not a new issue. It's an issue that has just not been overlooked, but has just been part of the woodwork over the years. We've managed it, we've processed it, it's just been a reality. What's happened though in March of 20 with the pandemic, there were a number of exemptions that were put into place by CMS that essentially waived the need to recertify during the course of the public health emergency. In April of 2023, the public health emergency essentially ended, which ended back in 2022, December of 2022, but terminations started as of April of 2023 based on recertification issues. What we were facing then was this huge bolus of members that had been extended throughout this public health emergency period, almost 2 years, through almost 3 years, and now facing not just those individuals, but those individuals who were currently active in our plan and requiring recertification moving forward. That sets the stage, but then there were additional mitigating factors that created an even bigger problem. Could we go to the next slide?